Hello everyone. Today I'm going to share with you all a case of chronic hoarseness with recurrent sinusitis, not responding to modern medicines. This patient used to get these complaints of hoarseness, sinus infection, which was due to DNS. She used to take the antibiotic, feel better, and again fall sick, and again take the antibiotics. And the same cycle used to repeat again and again. And tired of taking frequent antibiotics, she wanted to try homeopathy as the last option. So she is a 72 years old female, and I saw her in the year of 2022 in the month of October. She was advised surgery by the ENT because she was tired of these frequent infections and seeking a non surgical and a permanent solution. She opted for homeopathy. Most bothering for her was the problem in her throat with a splinter like sensation. The symptoms of her hoarseness of voice were that it used to get worse when she used to wake up in the middle of the night during 3 to 4 a.m. while talking. Any form of exertion on the vocal cord would make her symptoms worse, and warm drinks would help her throat. She also had cough with expectoration. The nature of the cough was yellow, thick, and it was salty in taste. It used to get worse in the midnight. There was no ameliorating factor for the cough, and she also had a headache, but she had not paid any attention as to what makes her pain better or worse. Ideally, we should educate our patients to, kind of be aware of what makes their symptoms better and worse, because that is one of the most deciding factors in evaluating the remedy. Her father had lung cancer. She desires sweets. She is thirstless. She gets the urge for stools after having a cup of tea. She sleeps on her back, and her palms and soles feel warm to touch. So she's scared of water, snakes, heights. She's the youngest in the family, and she said that my nature was very happy go lucky types. She has an aversion to bathing. She is, in a way, untidy, messy, and not very organized. However, very extrovert, means she was very forthcoming in establishing conversation. She used to share the information without any filters and established a very friendly rapport within the first few minutes of consultation. She calls herself very bold and a strong willed personality. She was given this particular remedy, and she noticed that in 2 weeks her headache and the throat problem subsidized by 50%, and her energy levels improved and she was more active. After 2 months, her throat improved, headaches have gone, there is no vertigo. She was repeated a dose of sulfur 200. After 5 months from the beginning, she had a relapse of similar symptoms, so the remedy was repeated again. Sulfur 200 in water, 8 to 10 drops twice a day for 2 days, followed by Saclac. Her complaints improved after sulfur again. Her energy levels were better. After 6 months, she is much better. She was advised to stop medicine, and it has been 3 years that she has no complaints at all. And she referred her granddaughter to me for atopic dermatitis. That's how I inquired about her, and the mother said that it has been more than 3 years and she's not had any recurrence or relapse of the throat problem or the allergy or the sinus, anything, and she continues to enjoy good health. So, this was the case. I will share the repertorization in the comments later on. Some confirmatory symptoms that I have found are helpful in order to, confirm the remedy sulfur are as follows. Often there is heat of the palms and soles. Fear or vertigo from heights is a very prominent symptom. Untidy, messy, most often these people are. However, you will also see that they are in the rubric fastidiousness as well. The discharges generally seem to be offensive. It could be sweat, urine, stool, or breath. The orifices are red, especially in children when they are sick. For example, the lips or the nose or the ears can get red. And there is a desire to drink water during the meals. These are some symptoms which you can confirm for sulfur when you are thinking of sulfur. I hope you could learn something from this case, and I'll see you next time. Thank you.